morning, Dave. Thank you so much for that. Here's where we begin. COVID-19. Ontario's hospitals warn they are bursting with coronavirus patients, pushing them to the brink of a capacity crisis. The Ontario Hospital Association saying in lockdown Toronto and Peel regions, surgeries have already been cancelled. There are more than 650 COVID patients in hospitals today. That's an increase of almost 80% in just 4 weeks. Of those patients, almost 200 are being treated in the ICU. Hospitals say they are running out of beds, making it tough to continue other tests, procedures, and surgeries. But the health minister taking heat at Queen's Park yesterday for saying that our hospitals are better off than those in Alberta.
There's no question that many Ontario hospitals are under stress right now, but to say that they're in crisis is not the case. Alberta is in crisis when you have to have double cohorts in a single intensive care room.
I think it's really unfortunate that the minister and frankly the government chooses which provinces it's going to compare itself to. Just saying that, oh, we're better off than one province because they're doing worse simply is just, I think, very insensitive.
Reports say Alberta has asked the federal government and Red Cross for help setting up more field hospitals. The chief medical officer of health says the province's rate of positive tests has now risen to 9.2%. Let's turn to the city now. It appears small social visits have become a big spreader of COVID-19 in our city.
I was astounded by it because the message has been so clear in saying not just stay home, but only hang out with the people that you live with. To see, that much in the way of people deciding that they're going to either ignore or find an excuse to put that message aside is surprising.
Now, this was a story we first brought you yesterday, but the mayor reacting to that new data that shows 1 in 5 infected Torontonians have had visitors inside their home or went to someone else's house. Ontario saw a slight increase in new cases yesterday with just over 1,700 reported, the most coming from Peel and Toronto. The province also reporting 35 more deaths from COVID. Mayor John Tory will be joining us here just after 7 o'clock, and we'll discuss everything that's happening with the city, obviously with what we're dealing with COVID-19 as well. Now, you may soon be able to skip that mandatory 14-day quarantine after landing at Pearson Airport.
The downtime, once you come back, you have to quarantine for 14 days. We want to knock that down. If you can land, you can get tested right away. And then you get tested again, I think it's 5 to 7 days later, and they both come out negative tests. You should be able to go on your way.
The Ford government is pushing for a program that would introduce rapid testing at the airport, with job postings already up for the positions, offering pay between $22 and $25 an hour. There it is. The job posting says passengers would self-collect an oral or a nasal swab for the tests. Now, still to come this morning, we're taking a closer look at some of these rapid tests. Dr. Stephen Newmaster, he's a genetics professor with the University of Guelph, and he's going to talk to me about that. That's coming up in 20 minutes' time. Meanwhile, let's talk vaccines. Health Canada expected to release a decision on a leading COVID vaccine soon. Health Minister Patty Hajdu says it's encouraging that the UK has approved the Pfizer vaccine for distribution, adding Health Canada's review of the shot is expected to be completed soon. The Liberal government has been facing increasing criticism about the rollout in our country, with the provincial government saying it still doesn't know when they can expect doses or how many. The federal Conservatives are expected to introduce a motion today in the House of Commons demanding specific details of this plan. Well, this is interesting. Video chat, it's become a daily part of our routine for many people during the pandemic, and now it's going to allow us to speak to doctors without having to go to the hospital. Sunnybrook has launched a virtual emergency room for urgent but non-life-threatening care. Have a look.
What we're trying to do is address a gap in our current system. We recognize that the health system right now has been strained. What I was noticing during COVID wave 1 was a lot of fear and anxiety, and a lot of patients were delaying seeking care.
Okay, so Sunnybrook Hospital says patients would book an appointment with doctors able to make prescriptions in some cases. In others, you may be told you have to come into the emergency room. The 6-month pilot project was developed because of COVID-19, but some doctors hope that this system will become permanent. Let's get to the streets now. An update to a story CityNews has been following last night. A 23-year-old woman struck by 2 vehicles while riding her bike near Dufferin Grove Park has died. Police say this woman was cycling southbound on Dufferin when she was clipped by a vehicle thrown into a northbound lane. The woman then hit by another vehicle. Officers arrived at Dufferin and Sylvan Avenue just before 6:30 last night to find the victim with critical injuries. She did not survive. Both the drivers involved remained at the scene. As always, police are asking anyone who may have seen anything to please come forward. Okay, a quick break here this Thursday morning. Still to come as the pandemic goes on. A lot of people flooding to the suburbs. No surprise here. We're going to break this all down with some of the numbers and housing. 680 business editor Mike Eppel is next. Apologies for that video there. There's the video.